Okay, good afternoon everyone who's listening in. Thank you for joining us for the kickoff of Dangerous by Design 2016. My name is Alex Dodds. I'm the Communications Director here at Smart Growth America, and I want to welcome you. This afternoon we're going to be highlighting a new resource from Smart Growth America. It just came out this morning. It's Dangerous by Design, the 2016 edition. You can download it on our website at smartgrowthamerica.org/dangerous-by-design, Dangerous by Design. We welcome your comments and questions about this new report. There are tons of resources in it, as well as on the website. It includes a new ranking and many more things that you'll be hearing about shortly. The website also includes some interactive maps of pedestrian fatalities. If you haven't had a chance to check those out, definitely do. For those of you following along this event on the web, you can type questions into the chat box throughout our discussion. You can type them into the chat box on your screen. You can also tweet them to us. Our handle on Twitter is @SmartGrowthUSA, or we'll be following the hashtag DangerousByDesign. We have a great panel lined up for you today. You're going to be hearing from Emiko Atherton, Director of the National Complete Streets Coalition, which is a program here at Smart Growth America. You'll also be hearing from Nancy Lamond, Executive Vice President and Chief Advocacy and Engagement Officer for AARP, Charles Brown, Senior Researcher and Adjunct Professor at the Alan M. Voorhees Transportation Center at Rutgers, the State University of New Jersey, and Trenda McPherson, State Bicycle and Pedestrian Safety Program Manager at the Florida Department of Transportation. To start us off on our program today, I'm going to turn it over to Emiko Atherton, Director of the National Complete Streets Coalition. Emiko?
Thank you, Alex, and thank all of you for joining us today for this webinar. We are really excited to release this report. It's been 2 years since we've done this, and there are a lot of new findings we're excited to share with you. And with that, I will go ahead and get started. Although I should say first, the National Complete Streets Coalition, if you are not familiar with us, we are a program of Smart Growth America, and we are the founding organization of the Complete Streets movement. We work to advance complete streets through technical assistance, advocacy, and thought leadership. Dangerous by Design falls under our thought leadership category. We are in our 11th year as a coalition, and as a priority for the coalition right now, we're really emphasizing equity and implementation, and I think you'll see those themes today in our report. And with that, I will go ahead and get started. So what's in Dangerous by Design? What are the key findings? What's the summary? So what we did is we examined we used a pedestrian danger index from 104 MSAs, these are metropolitan statistical areas, and this is up from 51 MSAs in 2014. We also looked at state PDIs for the first time, and I'll dig more into these, what we found momentarily. But some key findings I want to stress are people of color and older adults are disproportionately represented in pedestrian fatalities. For the first time ever, we looked at how income and insurance levels are correlated with the likelihood of being killed by a car while walking. We do know that street design plays a major factor in creating and preventing pedestrian fatalities, and we really recommend that governments at all levels, at the local, regional, state, and federal level, and that includes departments of transportation, departments of planning, elected officials such as your mayor, your county executive, your governor, your congressional representative, our secretaries such as our Secretary of Transportation, take action to build better and safer streets for all users. So the national trends, between the decade that we studied, and that was 2005 to 2014, 46,149 pedestrians were killed. However, you'll see that in the last year that we had data, which was 2014, 4,884 people were killed. You'll notice the trend is also in a V shape, and what's going on here, we looked at, qualitatively what you see between 2005 and 2009, and particularly between 2007 and 2009, is a decrease in what's called vehicle miles traveled, or I will start to refer to that as VMT. And so that is really people driving less. People were driving less. And a large part of that was due to the Great Recession. People were out of work, which meant people were not traveling to work. People were spending less money. They were walking to less grocery stores, to less bars, to less restaurants. And then what happened is in 2009, the economy rebounded. People started going back to work. Vehicle miles traveled increased, or VMT increased. And at the same time, we started to see a shift in preferences for people wanting to walk or needing to walk now that they were returning to work. We particularly see that in the millennial generation, and we also see, and you'll hear later from Nancy, people who want to age in place, so people 65 years of age or older who are wanting to walk. So those are some of the national trends. Within the actual MSA, so as I mentioned, we looked at 104 metropolitan statistical areas. This is up 51. And really what we found is that 8 of the top 10 most dangerous places to walk are in the state of Florida, and you can see that in the map in front of you. For further reference, 9 of the top 20 most dangerous places to walk in the United States are also in the state of Florida. However, what you can't see in just the list alone is that the majority, or 30 of the 51 metro areas that we looked at in 2014, their PDI has actually improved, and some of the changes in the PDI are really small and might reflect natural variations in walking rates. But the PDI increased from 2014 to 2016 in Jacksonville, Florida, Memphis, Tennessee, and Riverside, California were significant enough to raise the MSA overall average PDI, the MSA's overall average for PDI. Let's move on to states. So for the first time ever, we developed a state PDI. So what are the most dangerous places to walk? Here you will look at, and you can see this mapped out. The highest PDIs are in the southwest and southeast, except for the state of Delaware. So it's that strip of purple. And then unfortunately, 31 of the 50 states have actually had their PDI has gotten worse, or it's gone up since 2014. And we saw this particularly in the state of New Mexico, Mississippi, Alabama, Florida, and Arizona. As I mentioned, we really wanted to dig into who is most impacted by these pedestrian fatalities. So we started to look at the representation of people of color in pedestrian fatalities relative to the rest of the population. And you can see here on this chart, and I should mention all of these charts are in our report, so don't feel like you need to take a screenshot or write anything down. But what we can see in this report is that 34.9% of the population is non-white, including Hispanics. But they are represented in 46.1, that's almost half of pedestrian deaths from 2005 to 2014. When we dig in a little bit more, we see that Native Americans are only 0.7% of the population, but they represent 2.7% of pedestrian deaths. Non-white individuals are also overrepresented in pedestrian deaths in 42 of the 49 states, and this includes the District of Columbia. So really what this is people of color are at higher risk of being struck and killed by cars while walking than non-whites. We also did a national PDI, Pedestrian Danger Index, on race. And what this says is even after controlling for the relative amounts of walking for these populations, risk continues to be higher for some people of color and older adults, indicating they most likely face disproportionately unsafe conditions for walking. And said another way, often people of color have to walk more. They have the lowest car ownership rates in the country. But what this bar chart in front of you is saying is that even after we control for the fact that they walk more, that African Americans and adults over 75, which you don't see in this chart, are still more likely to be struck and killed by a car while walking. So let's move on to the age. We'll hear a lot more from Nancy at AARP, but what our report showed is that older adults aged 65 or plus were 50% more likely than younger individuals to be killed. One of the reasons that AARP sponsored and partnered with us on the support, and I should say as a leading member on the National Complete Street Steering Committee, is because there is a rise in the number of people who will be age 65 and plus. It's going to double by 2016 according to the CDC. But that, and as I mentioned before, people are choosing to age in place. Older adults want to walk more, but the PDI for those 75 or plus, as I mentioned, is 42.5 compared to the overall PDI of 18.5. So that's huge. That means that once you hit 75 in this country, you are twice as likely to be struck and killed while walking than someone who is younger than them. What you have in front of you right now is the relationship between metro areas and median household income and PDI. And so what this really says, and you'll be able to find this also in our report, is that wealthier areas have lower PDIs. And so if you live in a wealthier area, you are less likely to be struck by a vehicle and killed if you're on your feet. And the second slide that's in front of you shows the relationship between those who are uninsured and PDI. So the communities have the highest amount of uninsured are also most likely, your risk of being hit goes up substantially. And unfortunately, those are the people that have the least access to health care. So not only are you more likely to be struck and killed or severely injured by a car, but you don't have the insurance rate. You don't have any insurance, so when you go to the hospital, you are to bear that cost yourself. And so with that, those are our basic findings. I'm going to turn it over to Nancy Lamond at this point, who's going to really talk from the perspective of AARP and one of our most important populations in the United States. Thank you, Nancy.
Well, thanks very much, and we're pleased to support this important report. I'm going to say a few things to amplify what's already been mentioned, and then we look forward to the opportunity for questions. The streets in our communities are not working for older Americans, and this important report kind of emphasizes that and shows that pedestrian fatalities are rising. The share of traffic fatalities attributable to pedestrian deaths, currently at 15%, has been rising over the last decade. And in 2015, we saw the largest increase in pedestrian fatalities since 1996, 9.5% over 2014. The report also shows, as has been mentioned, that older adults, 65 plus, are disproportionately represented among pedestrian deaths. Seniors make up 20% of all pedestrian fatalities in 2014, while only being 14.5% of the population. They are 50% more likely to be struck and killed by a car while walking than those who are under the age of 65. Obviously, this is an important issue for us. Today, more than 1 in 5 65 and older Americans, about 8 million of them, no longer drive. And they need a variety of options, including the ability to walk safely, to stay connected to their communities in order to function in any meaningful way. Older adults may be experiencing more exposure to pedestrian crashes as they seek these alternative ways to get around and try to kind of live up to everything they're being asked to do in terms of undertaking the powerful health benefits of walking. Now, unfortunately, streets are not designed to be safe for all users, and that presents harmful risks for more vulnerable pedestrians. Seniors often need more time to cross the street, and signals time for quicker paced walking may leave an older individual in the middle of the street when the light changes. Seniors may not be able to react quite as quickly to an oncoming vehicle as a younger person. And as we say here, you shouldn't have to be somebody who has the ability of a former Olympic sprinter to be able to get safely across our streets. Once struck, seniors tend to sustain greater injury for a given crash severity. In addition, they tend to have worse outcomes for the same injury, making them less likely to recover from a serious collision. Land use plays a part as well. A larger proportion of older adults live in suburban areas where roads were built to accommodate fast-moving vehicles. Between 2003 and 2012, 57% of older pedestrian deaths occurred on arterial roads, and this means that too many seniors simply cannot walk safely, bike, or take public transportation to their destinations. We're not just concerned about the implications of this report for today. We also, as you mentioned a few minutes ago, have our eye toward the future. By 2030, just 13 years from now, the 65 and older population will have doubled from what it is today to more than 70 million people. This important report should ring alarm bells for the safety of pedestrians across the country. Our infrastructure is failing us. We know how to design safe streets. Research shows that well-designed roads can significantly reduce deaths, injuries, and automobile crashes, and not just for seniors. A curb cut designed for a wheelchair user also benefits a parent pushing a baby stroller, and a crosswalk safe for a senior is a crosswalk safe for a child. This is why AARP has been a strong proponent of the enactment and implementation of safe and complete streets policies across the country at the city, state, and federal levels. Safe and complete streets are planned, designed, constructed, operated, and maintained to be safe and convenient for all who need to use the road, regardless of their age or their ability. The most effective complete streets policies include implementation plans to ensure that transportation agencies incorporate the consideration of all road users into every phase of a project. This includes review of agency policies and procedures, staff training, updating design manuals, and updating performance measures. We believe that America's safe state, federal, and community leaders should focus on making our streets much safer, which will benefit everyone, including this rapidly growing population of older Americans. A community that's friendly for an 80-year-old can be friendly for an 8-year-old and everyone in between. Safer streets for Americans of all ages is key to creating brighter and economically stronger futures for our nation's communities. And again, we applaud you for this, this important report. And with that, I want to turn it over to Charles Brown.
Thank you, Nancy. Thank you, Smart Growth America. Good afternoon, everyone. My name is Charles Brown. I'm with the Voorhees Transportation Center at Rutgers in New Jersey. I would like to start by saying that I'm honored to be on the call with you today and share that I find myself in a very unique position to discuss this portion of the report and the research findings. In terms of full disclosure, I have lived, worked, and served in the military in 4 of the states listed in the top 20 in terms of 2016 rankings of states with high statewide pedestrian danger indexes. Those states include Florida, ranked number 1, Mississippi, ranked number 4, Oklahoma, ranked number 16, and New Jersey, ranked number 20, which is where I currently reside. I'm also an African American who cares deeply about transportation equity and environmental justice. So as you may imagine, I'm very troubled by the conditions of the built environments where many of my family, friends, and former and current colleagues reside. Having said that, I would like to take a brief moment and let the people in Florida know that my thoughts and my prayers are with them as they deal with the recent acts of violence within the state. So today I would like to briefly discuss or address 3 questions. The first question is, why should equity advocates be worried about pedestrian deaths? The second question is going to be what are some strategies that communities could use to address some of these inequities in their communities? And then lastly, how does dangerous design affect communities of color? Starting with, why should equity advocates be worried about pedestrian deaths? Well, on the most basic level, equity advocates are worried about these deaths because they represent more than just numbers or statistics. These numbers reflect the tragic and, in most cases, preventable deaths of everyday people in the streets of America, many who are mothers, fathers, sons, and daughters. Equity advocates who spend a lot of their time striving and fighting for fairness and justice within the transportation context understand that a disproportionate number of these deaths are people of color and older adults, people who are simply trying to get to work, visit a family or friend, walk to the nearest store, or travel to and from work when they were struck and killed by a car. In fact, it's unfortunate that each time this report is published, the same theme emerges. Communities of color and older adults are disproportionately victims of vehicle and pedestrian crashes. Equity advocates understand that these deaths in most cases are a symptom of a much larger problem or a set of problems. In short, there's the well-known and documented cases of disinvestment and lack of maintenance of pedestrian infrastructure in these communities, as well as massive roadway projects that have literally castrated these communities while protecting others. So when you ask how does dangerous street design affect communities of color, the most obvious answer, of course, is loss of life, along with other and most often overlooked serious and life-altering injuries. But it doesn't stop there, unfortunately. Dangerous street design affects communities of color in every measurable way, socially, economically, environmentally, etc. It drastically diminishes safe access to jobs, parks and open space, places of worship, other vital services, and other modes of transportation as well. It also affects social cohesion, health and wellness, air quality, and property values. And when it comes to the latter, property values, we all know that many seniors and people of color, greatest asset is their homes, so this is a vital, vital resource for them to protect. Equity advocates, in short, they really want justice. Therefore, equity advocates appreciate and respect the position Smart Growth America has taken in publishing this data, because they all know that what doesn't get measured doesn't get done. They also know that without data, all you have is an opinion. As such, these data provide the facts they need to advocate on behalf of the victims, their families, and those dealing with these challenges in their respective communities. I must add, however, that equity advocates are concerned, though, that once change and investments finally do come to these communities, the very people that need to benefit from them won't have an opportunity to enjoy them. Because there's a quote that says, trees in low-income communities mature just in time for gentrification to take place. I repeat, trees in low-income communities mature just in time for gentrification to take place. So what are some strategies communities should consider? The most obvious, of course, is that of funding. Given the disinvestment in communities of color and the fact that these communities are disproportionately affected by these crashes, it is time for cities to give a disproportionate share of their funding to address the overall lack of pedestrian infrastructure in these communities. Of course, there are political challenges associated with this approach, but until bold political actions are taken to ensure the safety of people in these communities, death will remain their unfortunate and untimely reality. If you don't believe me, check the data. This leads to my second point, or strategy, politics. In addition to suffering from a disproportionate number of fatalities, these communities also suffer from a disproportionate access to political power. In short, they lack the political capacity and relationships to get meaningful change in their communities. Therefore, their concerns are simply not being addressed. Another strategy I would love for cities to consider is in terms of their police prioritizations. Police devote a vast amount of resources to addressing violent crime. While that is, of course, a wise strategy, I would encourage police strategies to build up their traffic departments to help deal with issues such as speeding and distracted and drunk driving that is wrecking these communities. Also, very few things are more violent than seeing someone killed at a car at 50 miles per hour plus. Also, let's not forget about our rural communities. I stated earlier, I was reared in Mississippi in a very rural environment, and we know politically there is a rural versus urban suburban divide in this country. But let's not forget about the rural environments. There are people there that do walk. They don't all have cars, and they are not invisible. In fact, many of them are the victims present in this data. So I would encourage more cities to adopt complete street policy, because even though many of the states listed in the top 20 have a fair share of policies adopted, they're not being implemented. And we need more adoption, and we need more implementation of complete street policies. And then there's this issue of walkability assessments that are happening throughout the country. It tends to be a buzzword now. Let's do a walkability audit. But I want to let you know that if you're doing a walkability audit and it doesn't take place at some point at night, you are not doing the night walkers justice. There are a lot of African Americans and seniors who are walking at night to and from jobs, et cetera. So please do your walkability audits at night. And then lastly, there's this issue with the transportation decision-making process. Even though transportation officials are required to hold public meetings in communities, many communities of color do not feel that their voices are being heard, and this simply has to change. So that concludes my portion. So I thank you, Smart Growth, for giving me an opportunity to discuss this. Now I would like to turn things over to Trenda at the Florida Department of Transportation. Trenda?
Thank you so much, Charles. Florida has a focused initiative to improve pedestrian and bicycle safety, and our statewide campaign focuses on areas where we see the highest representation of pedestrian and bicycle crashes that are resulting in these fatalities and serious injuries. But even in areas that aren't prioritized, work is still being done. Our initiative is a comprehensive campaign that combines engineering, education, enforcement, and emergency response elements. And leading all of these is our Complete Streets Policy and Implementation Plan. Through this plan, we're rethinking the way we design and build roads. We've adopted a complete streets approach that means our entire transportation system is being planned, designed, and built to ensure the safety, mobility, and accessibility of all users. And as Charles pointed out, Florida is a very diverse population, similar to what he was describing, and so we certainly have to consider every user of our roadways. So whether you drive, walk, or bike, we're building the right roads in the right place to serve the right function. In our highway and traffic engineering, we have ongoing operational improvements. They include the addition of high-emphasis crosswalks and pedestrian countdown signals, timing the signals so that those aging pedestrians do have time to cross those roadways, adding leading pedestrian intervals, advanced warning signs, speed reduction initiatives, and improved intersection lighting, not just pointing so that the cars can see where they're going, but so that they can see those pedestrians crossing in those crosswalks. In partnership with the Federal Highway Administration, FDOT provides training to state and local partners. Some examples of those trainings include road safety audits, training on complete streets, designing for pedestrian safety, developing pedestrian safety action plans, and improving intersections and intersection safety. The components in our outreach and education program began with FDOT establishing strategic alliances with state and local partners, with other stakeholders, with safety advocates, and pulling together Florida's Pedestrian and Bicycle Coalition. This coalition is charged with implementation of Florida's Pedestrian and Bicycle Strategic Safety Plan. Campaigns from the Coalition for Outreach and Education are geared towards increasing awareness, increasing compliance with traffic laws, helping users understand the safest places to cross, understanding the pedestrian and bicycle-related signs, signals, and pavement markings, decreasing distractions, not just on the part of drivers, but on the part of pedestrians as well, reducing the number of impaired, speeding, and distracted motorists that are impacting our pedestrians and bicyclists. And then we take it another step and work with our emergency response by providing ongoing training to first responders on the most common types of injuries that are occurring from these crashes, so they can arrive on scene prepared to provide a high level of care and transport. Followed by high visibility enforcement. Our high visibility enforcement initiative is an evidence-based initiative that was established 4 years ago to engage local agencies in our effort of improving the pedestrian and bicycle safety situation. This effort is focused primarily on education. Our officers are on the street talking to the locals and helping them understand what it is that they're doing that is making them unsafe and how to be safer in their actions, whether they're driving, walking, or biking. When we began this program, there were only 13 agencies of our entire 300 agencies in the state that engaged. Currently, in our 4th year of implementation, we have over 60 agencies engaged in this process, so we're very excited about that. Florida's High Visibility Enforcement Initiative focuses on key areas across the state where we see the higher representation of pedestrian and bicycle-involved crashes, and we focus those resources there appropriately as we do with the rest of the campaign. Just making sure that as we're out in those areas, we're not just targeting specific where there are crashes, because we know that they don't occur commonly at intersections, but more along corridors. Just making sure that we're reaching all of the affected areas and covering those, saturating those areas. There are also many local and state programs addressing pedestrian and bicycle safety, which is evidenced by the number of participants that Florida contributed to Secretary Fox's Mayor's Challenge. We had more than any other state in the nation. I believe there were around 36. So it was definitely evidence that our local and regional partners are also engaged in this process. The key to successfully resolving the problem is to conduct that combination of high visibility enforcement, of public education, to make sure that those efforts support the engineering treatments that are being implemented. And in key areas where we've applied those engineering and education enforcement operations, and we've made sure that we've conducted significant pedestrian and bicycle engineering improvements, we've seen excellent response. Orlando, for example, is one of the areas that we focused on, and you can see from the Dangerous by Design report that they've experienced a significant improvement since the last report was released. Miami, Fort Lauderdale, and West Palm Beach have had similar improvements as a result of this same combined effort. Florida as a state has made notable improvements since the initiative began in 2011, but we're not stopping, not until we reach zero, because we do believe here that every life counts. And now I'll turn it back over to Emma Atherton with the National Complete Streets Coalition.
Thank you so much, Trenda, and thank you, Charles, and thank you, Nancy, for really covering this from all different perspectives that are really important to us. I know I learned a lot, and I think I will take all of what you said and continue to deliver this in the Complete Streets program. And mentioning the Complete Streets program, I wanted to touch briefly on street design and what we feel are our recommendations for really what can we do about these pedestrian fatalities. One of the biggest factors in unsafe streets is speed. Speeding causes nearly a third of all traffic fatalities each year, and that's close to 10,000 deaths. And pedestrian fatalities are really overrepresented in these. So we have, that's the design, policy, enforcement, and culture also contribute to these. But in terms of design, we're talking about, I think, streets we've all experienced, really wide roadways, or what we call wide arterials, lacks of sidewalks, crosswalks. I think Nancy mentioned this, crosswalks where you need to be an Olympic runner to get across. And that at the Complete Streets Coalition, we really believe that designing a transportation system for all users, but really specifically those most disproportionately impacted by incomplete streets networks, are needed in order to move these numbers. We need to prioritize spending for projects that serve all users of the transportation system. And when I mean all users, I mean those in wheels, those using their feet, and wheels can be wheelchairs, they can be cars, they can be bikes. So we're talking about different modes, but we're also talking about geographic area, and that really all users encompasses not just creating a bike lane in a downtown center, or having sidewalks on your main street, but that you're reaching all communities so that people can safely access the transit stop so they can access employment opportunities. However, those changes really need to happen from your local, state, and federal governments. Local governments control a lot of the local roadways. They also have some control over the spending. Mayors, city council members, city managers, county executives, your metropolitan planning organizations need to prioritize projects that serve all users of the roadway system and make sure that they are targeting projects in historically disinvested areas. There also needs to be a culture change really within planning and transportation, that we're starting to think about all users. A lot of the cities where we look at some of the highest fatality rates they operate on transportation systems that were really built with one user in mind, and that's the car. A lot of the southeast, where we see some of the states with the highest PDI, were built post-World War II, where really the goal was to move vehicles, not to move people, and we need to shift that thinking. At the state level, they also have a lot of control over funding, where projects and how projects get built. They have a lot of control over major interchanges, and so states need to do work to really do that cultural change, but also the policy planning and procedure change. And to Florida's credit, they have one of the best complete streets implementation plans. And I know that FDOT, under the leadership of Billy Hadaway, who's now at the city of Orlando, has done a lot of work to really do both the cultural change and the process and planning change. At the federal government, there's a lot to do. I think the federal government controls most of transportation spending, and it needs to be directed to projects that serve all modes, whether that's discretionary funding or formula funding. We need to work on, our federal government needs to work on promoting safety for all users through any way that they see fit. In December of 2015, Congress did pass the FAST Act, which had the Secretary of Transportation encouraging states and MPOs to do education around complete streets, to provide more training. I think there's a lot more we can do. And with that, this is a coincidence, but not a coincidence, that when we planned this release, we did not know that tomorrow there is a hearing scheduled for Elaine Chao, who has been nominated by the President-elect as our new Secretary of Transportation. And we want Elaine Chao to really address pedestrian safety. I think this is a great opportunity to use the information in this report to tell the Senate Commerce Committee to ask Elaine Chao how she plans to really address pedestrian safety. There is a link. We will also send a follow-up email for everyone on this call with a link that you can tell the Senate Commerce Committee to ask Chao how she plans to address pedestrian safety. This is huge. I think we've been able to make a lot of grounds on equity in transportation because of the commitment from Secretary LaHood and Secretary Fox. Under President Obama, we really believe that we have heard Elaine Chao make a commitment to safety, and we want to make sure that she stands by it, and making sure that those tough questions are asked in her confirmation hearing are very important. There's also the report, which is now available online with some amazing online resources, such as a heat map where you can look at where all of the pedestrian fatalities occurred in your area. It's a powerful tool for storytelling, and so do not forget to send this report out, to read it, to share it with your friends, your colleagues. Make sure the Senate Commerce Committee knows about this. And from that, it looks like we have about 15 minutes, and so I'm going to turn back to Alex Dodds, and she is going to field some questions and answers for us.
Thanks, Emiko. So yes, this portion of the call is for your questions and answers from our panel. If you're following along on the web and watching the webinar, you can type your questions into the box on your webinar screen. We're also following along on Twitter at the hashtag #DangerousByDesign. You can ask your questions there, and we'll try to get to them. We've already had a lot of questions, and we'll try to get to as many as we can. One of the most common questions that we always get is, will this webinar be recorded? And the answer is yes. So let me start by knocking off at least 20 questions by answering that. Another really common question that we've had, and this is for you, Emiko, is tell us a little bit more about the methodology. Specifically, how do you calculate PDI?
Thanks so much for asking, Alex. The PDI, or as a reminder, the Pedestrian Danger Index, really looks at someone's exposure to risk based on where they live. If we were to just look at kind of total numbers of pedestrian fatalities in the city, we'd see cities like New York and San Francisco at the top of the list because there are a lot of people living there. So we need another way to measure it kind of moves beyond just looking at total numbers. I shared this analogy with someone earlier, and I should out that I'm from Seattle, so it's a little biased, but you could say, what's the relative exposure to a Starbucks based on your city, and I'm from Seattle, and if there are 1,000 Starbucks there, but it's also a large city, you take a city like Hall of Tennessee, which has a population of about 2,500, and if they had one Starbucks, I think their exposure to Starbucks would be higher. I don't mean to make light of this, but it's a complicated thing to understand if you're just starting to get into it, but it's so important. So what we do is we take walk-to-work data. So we do take community data, and we do that because it's our best proxy. I wish we had better numbers, our best proxy for walking. I wish we had better numbers, national numbers, that were also broken down by race, ethnicity, age, on the share of people walking, but unfortunately it hasn't been a priority in terms of data collection, and that is something that hopefully there are some researchers and people out there that will look to this. So we do take this proxy for walkers, which is the walk-to-work data, against FARS data, that's fatality analysis reporting statistics, and that's where we find the pedestrian fatalities. And through this, looking at using both the FARS data and the walk-to-work data, we developed this PDI, which is the relative it shows your ranking, your likelihood to get struck and killed by a vehicle based on your MSA.
Yeah, and that was another question that we got. Does this data look at only the city? We had a couple of city leaders on the call who wanted to know if this was specifically about their city or the larger MSA.
It is about the larger MSA, Alex. I think that's for two reasons. That's where we can get data that matches up, and we want good data. But it's also, I think, most people don't just live and work in one city. Many of us choose to live in communities and work in other ones. We have friends, we have churches, we have healthcare facilities in other communities, and so I think the MSA actually captures a more realistic view of travel patterns of individuals.
Okay, well, speaking of travel patterns and a little bit related to methodology, Trenda, we've got a question for you. One of our listeners asks, could there be a skewing of Florida's data because of snowbirds and tourists? We know that Florida has 7 of the top 10 most dangerous. Is that just because there's a bunch of older adults there and tourists?
Well, it's really a combination. Florida has had a very rapid population growth. We rank number 3 in the nation for our population. We have more than 100 million visitors to Florida annually, and 19% of our population is over age 65. And so with that, there comes the cultural diversity, the climate. But a lot of people move here to retire. So only about 58.8% of all Floridians are in the civilian workforce. And our estimates, Florida Census estimates, is that only about 1.5% of those actually walk for their commute. And so, yes, the numbers could be skewed based on the fact that it may or may not consider those percentages of retirees or people who settle here or just, like you said, come here as snowbirds. And we certainly are seeing that we do have a big problem with pedestrian safety here in Florida, but we're also seeing that the dynamics in Florida are considerably different than other states. So I would say, yes, they could be skewed. I've not really dug too deep into the methodology that you guys use, but looking at it from our data and the data, like you said, that's limited, that is collected, we do see that maybe the commuter ranking is not quite as significant as what's shown, but we do still have a problem, and we accept that and are working really hard to address those challenges.
Thanks, Trenda. And this is Emiko. I just wanted to add in that this report actually ranks states by risk for seniors on page 20. Again, you can get the website and our methodology for PDI within our report, so make sure to get it because you'll get a very scientific explanation for the PDI and dig into these reports. So back to the state and seniors, Florida is actually number 34. And what that means is seniors are not Florida's biggest problem.
Correct. We did initially have a problem with aging drivers who were impacting pedestrians and bicyclists, and by working with our Safe Mobility for Life Coalition, AAA, AARP, and all of our partners there, we've actually been able to reduce those crashes. So they are not a significant portion of our challenge. Our median age for pedestrian fatality is age 50.
Wow. Well, thanks, Trenda. Well, I think digging into the numbers and the information behind it is definitely a trend that we're hearing among the questions. We have another one for you, Charles. Basically, we've heard why older adults might be at higher risk of being struck and killed by cars while walking. Can you just go a little bit more into some of the reasons why people of color have a larger share of fatalities here?
Well, I think the report goes into great detail with the data sort of addressing this question, but what I would say is that we know that there is low car ownership among minorities. We know that many minorities depend on public transportation and therefore are walking to and from these services. We know that there has historically been disinvestment in minority communities. Therefore, the built environment is as such that it's very dangerous for anyone in a community of color to be traversing to and from these locations. So there are a number of variables that lead to unsafe conditions for minorities, whether it be in Mississippi, Florida, or otherwise. But as I was stating, it's really time to kind of look at where funding is happening relative to where we know there's a disproportionate share of people being killed in communities. So let's see if the dollars prioritize the lives of these individuals in these communities. And I would love to be proven wrong, but I think you'll find in many cases that where the demand calls for investment, the money is not going there.
That's a great point, and certainly one of the themes of this report is the way that our transportation investments are serving different populations and communities. Emiko, sort of related, it seems like one of our listeners observed that it seems like the Northeast scores pretty low, whereas places in the Southeast and Southwest are scoring pretty high, meaning that they are more dangerous. Do you have any ideas or hints as to why that might be?
I do, Alex. Thank you for asking the question. I think there are a couple of different reasons. When we're looking at the actual MSA level, the cities, particularly in the Northeast, are older cities. They were built kind of pre-car. If you look at, a Philly, a New York City, we had horses. People were using carriages to get around. People were using their feet, and so we have they are huge cities with, I think, smaller blocks. I think there's better pedestrian infrastructure there. They are older cities. And so in the Southeast, we have newer cities that were built post-World War II, as I mentioned, with the auto in mind, so this idea of moving people. I do think that although that there has been more political will in some of the northeastern cities, through, if those of you are familiar with the Vision Zero initiative to adopt the Vision Zero network, I know New York City and Polly Trottenberg are really leading on Vision Zero that was started under Jeanette Sadekon. I do think, though, that ultimately the street design in the Northeast does support, your exposure to risk does go down, although we do see a high rate of fatalities in the Northeast. So if that makes sense?
Yeah, absolutely. So on the topic of cities, I've got a question for Nancy. A lot of demographic trends are showing that older adults want to move back to cities as they look to downsize and possibly move back somewhere a little bit more walkable. How do you think that trend of older adults moving back into cities is going to impact this issue?
Well, there is a trend in a lot of places for older people to downsize and move back into cities, but there's some limitations to it. In our great city of Washington, D.C., the kinds of housing they're looking at is very expensive. So I think this is going to be a choice that's not quite as dramatic as some of the early data showed. And again, then what they're looking for are very walkable areas. So I think if people are moving back into the cities, they're going to look at places where they can walk to amenities, whether it's healthcare or restaurants, et cetera. But regardless, no matter where they are, they still have to be very aware of challenges crossing the streets. In our own lovely city here, I'm struck by jaywalking as much as crosswalks. So I think we're going to see that pattern of people kind of moving into the cities, but not probably as dramatic as we might think. The other thing I might add in terms of cities, as you know, we are very involved in the World Health Organization's Age-Friendly Cities program. We have a number of cities we work with around the country. All told, we work with around 200 cities and communities on livability. And I would say if this isn't the top issue, it's one of the top 2 or 3. This is very much top of mind, and therefore your research and work is, frankly, even more important to us as we look at our broader agenda.
Well, it sounds like you're going to need some help making all of that happen. And a question for you, Trenda. We know that DOTs measure level of service for cars, so tracking how many cars travel through a corridor and how quickly they go. Is FDOT specifically, or other DOTs that you know of, considering multimodal levels of service, or considering level of service measurements for this type of outcome?
Yes, as a matter of fact, we are. We're working on looking into those different processes now and how we might be most effective. But with the new performance measure requirements that were brought out with the FAST Act, we certainly are considering a whole range of new ways to look at our streets and make sure that they're safe for every road user out there. So absolutely yes.
Great. Well, we've had many, many, many more questions than we could ever answer, especially given that we're almost at the top of the hour again. You can find all of the answers to your questions in the full report, which is at smartgrowthamerica.org/dangerousbydesign. There's information about methodology, the full rankings of all 104 MSAs in the country, detailed state-by-state information as it relates to people of color and non-white populations. Visit our website also to see 2 interactive maps of where all of these 40,000 plus collisions happened. There's an individual incident map as well as a heat map, which has some really interesting takeaways about the places where collisions happen over and over again. I encourage you all to go check that out. And I'm going to end the discussion with a question that I'm going to take, which is, I want to know more about bringing complete streets to my community. Where can I go? And the answer to that question is smartgrowthamerica.org/complete-streets. We have everything from how to write a complete streets policy to how to implement it and what transportation engineers can do to address this issue. That's it for our call today, but as Emiko mentioned earlier, we'll be sending out a recap, and a recording of the event will be available, so look for that in your inbox sometime soon. And thank you so much to everyone, to all of our speakers, and to all of you listening for joining us today.